Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Grace Yu. She's a family physician. Today's Kevin MD article is "The Backbone of Healthcare is Breaking." Grace, welcome to the show.
Thank you. Glad to be here.
All right, let's start by briefly sharing your story and journey.
Well, I was born as in Taiwan and relocated to the United States when I was about a year and a half. Came from a family of physicians and grew up in Mississippi. And then I relocated to California for medical school. And that's where I really kind of fell in love with primary care and family medicine and saw just the impact of family physicians and continuity care and developed my love of teaching as well. And so following medical school, I stayed in the area for the residency program in family medicine, then affiliated with Stanford, and upon my graduation joined the family medicine residency faculty here, and then 9 years ago became the program director of the program that I used to train in.
Wonderful. And your Kevin MD article is "The Backbone of Healthcare is Breaking." Tell us what led you to write this article and then talk about the article itself.
Well, it came up really in March. I was at this it's called the Residency Leadership Summit, and it's a annual meeting of all family medicine program directors across the country. So it's something like 800 plus program director leaders across the United States. And of that group, I am on the board of the Association of Family Medicine Residency Directors. And it's a group of about 12 program directors. We're all sitting around talking about the 2025 match results
Hmm.
because although there was some excitement that there were an increased number of spots that would help eventually fill this primary care workforce shortage that is purported to be an even bigger issue in the next 5 to 10 years, we were facing this issue that more programs had gone unfilled in the match.
Hmm.
And so that news of trying to figure out, well, on the one hand, we're expanding the number of positions. And on the other hand, our programs are really struggling and competing with one another for faculty recruitment and talented medical students who are applying to all of these different residency programs. And really, what we should be doing is not competing with one another for these resources, but really putting together a bigger campaign towards changing some of the structural barriers that have kind of led us to this position that we're in now. So it was this realization that we can't just keep relying and assuming that family medicine and the other primary care specialties will be there to fill the primary care workforce shortage by expanding slots when really you're putting too much competition for few resources and overworking those that you already have in the system.
So take us behind the scenes into that meeting of program directors. What did you guys conclude were some of the root causes that some of these family medicine spots went unfilled?
Yeah, I think, I mean, it goes down to three issues, which the three P's. So the first one is going to be payment reform, and the second one is practice redesign, and the third one is pathway. I think there are other components as well, but those three I think really just highlight the biggest issues. So with regards to payment reform, I mean, I didn't know this until I was a practicing physician that the same procedure can be done by two different specialists, a primary care physician and another specialist for the same outcome, and yet they are reimbursed at completely different rates,
Hmm.
with the primary care specialist procedure at a much lower rate. And our system is really built on this kind of fee for service model where the more patients that you see, the more procedures that you do on them, the longer the hospitalization is. For the most part, the system gets more reimbursement for that. Whereas really we should be thinking about a much more accountable care organization type of model, value based, where the better you care for these patients to keep them from developing those consequences and complications, the better the health system is reimbursing those
Hmm.
groups that are caring for those patients. So that needs to be an issue because that trickles down. Students are paying so much for medical school
Yeah.
tuition right now, and so if there is not an option to be able to recoup some of that loss or loan forgiveness programs, it's some way to kind of even the playing field, it will become very easy for students to just not even consider the positions where they will not be able to pay back those loans and get the same type of either financial and academic prestige that is necessary. The second piece of it was practice redesign. So I've been practicing in my clinic, and I work very closely in our residency clinic, and it's a lot of work.
Hmm.
You're seeing patients, and we are fortunate to be in a system that gives us a lot of kind of individual clinic flexibility for the number of patients that we're seeing per half day, as long as we meet certain targets. But I do know that there's a push to just always see more, and yet there's a lot of, for every patient that you're seeing, there are all the labs
Hmm.
and imaging follow-up results that you have to take care of, all the messages that patients are now able to very easily kind of email back and forth with the physician. None of that is compensated care. And so students see this, residents are seeing this and thinking,
Yeah.
how is this going to be sustainable? I frequently have students work with me when they're sometimes even in college, just trying to get a sense for if this is a field for them. And I have not ever had one who said, I don't love the work you do. But I had one recently. He said, I love the work that you do. It's so amazing. And yet I keep hearing about all of the after hours work and in basket.
Hmm.
These were not things that students had really kind of ever thought about or considered before, but they are a considerable issue now. And there are options, I think, like AI, the transformative
Hmm.
ways that it can make the clinician's work life a little bit easier so they can focus more on patient care is huge. We're starting to see some of that in my practice, and support for some of the answering of messages and things like that. But at the end of the day, everything falls to the PCP
Yeah.
because it is the drug prior authorization that needs to be done for that patient of yours to get the medication they need, et cetera, et cetera. And then the last P is pathway or pipeline. So our students often don't see the true value of and joy of continuity of care in their medical school rotations, whether it's in family medicine, internal medicine, or pediatrics. I remember when I was going through medical school that family medicine was not a required clerkship during your
Hmm.
third year. So most people were doing it fourth year and way past the time
Yeah.
that they're selecting their specialty choice. And then even when you didn't have the opportunity to work with the same clinician for a long period of time. You're working with a different clinician every half day. So you don't get a sense, what does it mean when a doctor has been with a patient for 10 years,
Yeah.
has taken care of their grandmother, has delivered their baby, and all of the kind of intangible benefits of that relationship that occur. And then in most IM and PEDS clerkships, those are very hospital based. They're, the outpatient component of it is not very big at all. Then there are also some of these elite schools, mine is one of them, that we call orphan institutions because they don't have a department of family
Hmm.
medicine. And so if you have students who don't see leadership in family medicine at the medical school level, they're not going to even consider that that's a practice possibility for them.
So I'm in primary care as well. I do internal medicine, and I can't believe I've been doing this for 23 years now. And a lot of the same solutions that you talked about, we've been talking about every year, and every year there's a
Yeah.
primary care crisis. So, what makes this time different? Why haven't some of the suggestions that you and your committee came up with, why haven't they already been implemented? Because I've heard that these solutions need to be done years before. Why hasn't it happened yet?
Well, there is this kind of fundamental mismatch that I didn't realize until that March meeting, that ACGME is the accrediting body that allows new programs to start or programs to expand. They don't look at all to like what is the need in a particular community. And so you've got different incentives that that hospitals have to start a new residency
Mhm.
program to try, and maybe it's completely in an area that is saturated with family physicians and family medicine residency programs already. And there are some, or primary care programs, and there are other areas that have very few of those. So there's this fundamental mismatch that right now they don't speak to each other at all. And I think having some way, and it almost requires, I think, a regulating body to say the two have to
Mhm.
be kind of working in concert with one another. Most programs do not know, most program directors do not know about that at all. So I think that's one piece. I think also I'm seeing a lot of change that is starting with our younger generation of residents and students. And it's kind of refreshing because in the era that I trained, we did what we were supposed to
Yeah.
do. We knew what we would ultimately get to, and it was worth it. I loved kind of the mentors that I worked with, and I would never have questioned that the things that they told me to do as hoops to go through in residency or whatever it was to achieve my final goal of being a family medicine educator and clinician were the things that were needed to do. There's a lot more questioning of that now. And sometimes that's for a really good tension for change. So maybe it will come as resident unions talk about this, or physician unions talk about the practice redesign piece of it that needs to
Mhm.
occur. And then I'm not really sure what the answer is to get the payment reform piece, but that is one of the most important things that needs to be addressed head on.
So, from a practical standpoint, what happens when a family medicine residency goes unfilled? What are some of the options that they have?
Well, there's this time period after they find out where they can go through something called the supplemental
Hmm.
offer and acceptance program, or SOAP. And then it's all the programs, whether it's in family medicine or another specialty, get a list of all the unmatched applicants, and all the unmatched applicants see the list of the programs that have not filled. And then they do this again, they do this match process and interview process, but it is in a very, very concentrated, essentially a 4-day period of time. So it's incredibly stressful for the applicants and the programs,
Hmm.
and very time consuming during this time period. And so eventually, I think what the general public hears is what are the match results at the end? What are the filled spots? And it is true in family medicine and the other special primary care specialties, the ultimate filled rate at the end of SOAP is high.
Hmm.
And so, but it is this unnecessary time period of stress, and also just why does that even need to occur in the first place that occurs. So I think ultimately there will be a lot of people who may end up choosing a specialty that they didn't initially plan to apply and match in, and then they choose that. And that might be in family medicine, it might be internal medicine, it might be peds, or it might be something else. There's a little bit of a pendulum that
Hmm.
shifts. So we knew that right after the pandemic, there was a decrease in ER. And then probably because of what people were experiencing or imagining what ER physicians had gone through during that COVID time period. And then it got better. But what is alarming is that I don't see a way for this next match to change considerably unless there's a reduction in the number of slots, or there is a significant change in the number of
Hmm.
interest.
So
That
when you
worries me.
so when you talk to the medical students who match to your program, for instance, obviously they chose family medicine despite all the obstacles that we're talking about today. What are some of the major themes why they chose family medicine in the first place, despite everything and all the impediments that we talked about in our conversation?
Oh, it's so wonderful. I mean, if you just listen to our residents as well as our faculty talk about why they chose family medicine, it is for all the right reasons. They believe in health equity. They believe in the power of a long-term relationship with patients. They believe in being able to do many different things in the scope of care, whether in our program, we train people to be able to do inpatient work, to deliver babies, to do outpatient medicine really well. And so many of them continue that full scope afterwards. And so I feel like if everybody heard this message, this would be so motivating in and of itself. And that's why I'm about to head into recruitment season when we start interviewing applicants. And this is, while it's a busy time, it's almost one of my most favorite times of the year because you hear every single day with every interview the affirmation of why this field is so important.
So, what about the future of clinics? There's a lot of uncertainty out there, right? In non-academic settings, you have things like private equity buying up practices, cutting costs. I hear stories of physicians sometimes being replaced by advanced practice practitioners, and that makes the future of primary care a little bit uncertain. And when I talk to medical students, it's that uncertainty that is one of the reasons that prevents them from applying. So, in terms of the future, and I know that we talked about things that should be done, but given the current climate, how do you address that uncertainty some medical students have about the field of primary care in general?
Yeah, I think a lot of people have asked, what are primary care clinicians going to be replaced by machines or robots, or
Hmm.
are we going to have these? And the power of that kind of human connection is not going to ever be replaced by a machine. There can be efficiencies that are gained. There can be a different way, maybe, of practicing that will be available to us in the very near or not so distant future. But I think the very reality that our graduates have no problem at all finding jobs
Hmm.
because there is such an immense need for more primary care physicians in this area, and some of them relocate to other parts of the United States, is proof that there will be jobs for them. Now, they may look slightly different, and they may be asked to have different types of skill sets than what we have traditionally trained for in the last 50 years of medicine. But that's the case for all medicine, I think.
Hmm.
So I think the
We're,
future still is bright.
we're talking to Grace Yu. She's a family physician. Today's Kevin MD article is "The Backbone of Healthcare is Breaking." Grace, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Well, I think that if you are a clinician who is not a primary care physician, but you work with one, just appreciate them, partner with them. That is a very important piece, to feel like we're working together towards the same goal, not competing. I think if you have influence, whether it's in your church, whether it's in your school, whether it's in a medical school system or healthcare system policy, I think we need to hear all those voices for why it's important to invest in physicians and in specialties that are really taking care of our entire populations. And then I think for family physicians who are practicing, my colleagues, I think it is important to know that you have so much immense value. Your patients adore you and appreciate you. Your students do too. Have joy in the medicine that you chose to do, and share your value openly out loud, and make people stand up and listen and appreciate the work that you're doing behind the scenes all the time.
Grace, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you.